Great. So, welcome each one of you, and thanks for being here. So, today's topic is like one of my favorites. Yeah. This is how to heal traumatic experiences using somatic therapy. Yeah. And this is such a wonderful topic because when I went through my own experiences and when I started confronting my uh, own traumatic experience, I know the kind of changes that it made in me. And today, so many years later, I am able to thank myself for going through it. Many people, even today, when I have my clients coming in, they're saying, "Why do I need to go through it?" First of all, secondly, can we do something that I don't have to go through all this confrontation and get rid of it? How many of you would like it like that? I don't have to go through it and I just get rid of it and jump over it, take the leap, and ekdam aisa clear ho jana chahiye, na? Most of them, right? But that is not how it functions. First of all, let's get this. That is not how it functions. So when we are doing core somatic integration, that is the workshop which I teach on healing through somatic therapy. So one of the things that is very, very clear is that uh, the only way out is through. The only way out is through. Means you have to go through something in order to get out of it. Right? Like I generally say that if you want to uh, you have entered a house through a door, and if you want to come out, you can only come out through the door. Okay? You can always say that, oh, if there's a back door and there's a window open, agreed, all that is agreed. But the thing is that generally, the door you enter, that's the way to come out. How many of you agree with this? So the door in and out is the same. And if you are entered to that door, that is the only way to come out. Right? So now, first of all, let's understand this. Yeah. That let me ask you a question. How many of you feel that you have gone through some kind of trauma? Raise your hand. Yeah. Or give me a thumbs up or write I in the comment section. Yeah. Write I in the comment section. You have gone through trauma or you are experiencing a traumatic experience even now. Yes, a lot. Put on your video, then I can see you. Okay. So now, there is no one on this planet who is not traumatized. See, the journey is very simple of life. That you're born, you're a clean slate, so-called clean slate. Let's not consider past lives and all that. Yeah. And they also they don't affect you till the time they don't get activated. Okay. So you're born as a clean slate. And then something happens in your life that is causing a sense of discomfort or feels as if it's impacting my survival. And for that small child, it is not about, oh, something catastrophic has to happen. But for that small child, it could be simple as that I am helpless. I'm just a 2 month old or a 1 month old or a 3 month old and I'm helpless. I can't even move and I'm hungry and I'm crying loudly and no one's come there to feed me. Or I'm feeling cold, my blanket has moved out, and my body is exposed to the cold, and I'm feeling scared. What is the child scared of? The child is scared of, I may not survive. I may not survive. It's all about survival issue, right? And that is a crisis moment for the child. At that time, the child doesn't decide, but there are feelings that are created because trauma is an experience, because trauma is an experience, it's not an event that happened. Now, that experience stays in the body. And every time there is some event out there which is similar to the feeling that is there, all these experiences get triggered off of trauma. That's why you have a repetition. Now, why does it get repeated? Why does it get repeated? You can put it on the chat. Why does it get repeated? Beautiful. Yeah, put it down on the chat. Why does this trauma experience get repeated? Memory. It's a memory, I got it. But why does it get repeated? The question is different. What does your mind seek? Your mind seeks resolution. Yes, it is unresolved. The mind seeks resolution. I have a very simple way of putting it. I put it as, you're born a clean slate, you get out a clean slate. And rest of the things are just happening in between. Yeah, so you're born a clean slate, let's call it contamination. You get contaminated, and the rest of the life or lives, if we talk about past lives and all that, then rest of the lives are just about cleaning it up. But how do you clean it up? It's only about you have to again encounter similar kind of situations to deal with so that those traumatic experiences come up and then you heal them. And then you become a clean slate. And then once you become a totally clean slate, then you're nirvana, moksha. This is how I see it. Make sense? Very simple. I like to make it very simple. Ki this is how I see it, and it has helped me in my understanding. And this is how I would explain to my clients. Makes it very easy. Don't get into too much of jargon. Don't get into too much of, oh, this life, that life, yes, that. Don't get into intellectual stuff. It doesn't help. The mind doesn't, it doesn't help the mind heal. It makes it very complicated. It's almost similar to forgiveness. Like you say, oh, but in my mind, I am forgiving that person. But then the pain is still there. Because the pain is an experience, and just that intellectually, when you forgive, it's just an intellectual, like a thought. It doesn't help. It has to get in from, like, what the difference between the head and the heart. It is a difference between the head and the heart. Okay. So it's very, very important. Shiv, I would request you to hold your questions, because you barging with questions will not help. Yeah, it's only taking my attention again. You write it somewhere, I'll take all the questions. Okay, Shiv? Because if you keep putting the question, we are going off the topic. So let's not get there. Okay? You write it somewhere, I'll answer all the questions. Right? So, is this for how many of you this is very clear? Or this is making sense? Write MS, making sense. Or it's helping you. Yes. Right? So we born clear, we go out clear. बहुत simple equation है life का. And rest, what we call as complication, problems in life and all that, it's only about resolving. And the more you stay away from it and you say, I'm not going to look at it, your life gets only worse. Why? Because the traumatic experience will push itself out to bring your attention to itself. Because it wants to go back clean and pure. Essence, what we call as essence. You're born an essence, you end up with that. But the only way to reconnect to the essence is through the pain. So when we are doing core somatic, we have this 4-step process. One is called essence. Second is called feelings. And third is called the persona. And then we call the projection. So all that pain you're getting is through projection, the end part. Because you're putting it on someone else. You're blaming the world. And the more you do it, the more you seem to be losing control. But the moment you take charge and you connect to what are you being, that the world is opening up like this for you, the world is showing up like this for you, you immediately feel as if you're in charge, though it's not completely that and not that easy. And then you're able to reconnect to your feelings. And that's the only way I have found that you heal. That's the only way I have found that you heal, that you reconnect to your feelings. And that is what we are learning in core somatic integration or integrative somatic hypnotherapy. And then you go back to your essence. And most of the people, like when they learn how to connect to the feelings, immediately they feel as if they have expanded. That is nothing else but reconnecting to the essence. That happens once a way, but it happens. And that is also a moment of enlightenment. And that is what is the meaning of healing trauma. Basically, what is enlightenment? When you're traumatized, that area becomes dark inside you. And that has a tendency to repeat itself. That's called compulsion to repeat. And why does it happen? Because it needs to heal. How does it heal? It has to have your attention back. How does it get your attention? By creating pain or painful events in your life repeatedly. And the more you avoid it, the worse it gets. The more you avoid it, the worse it gets. And then there comes a point where you start paying attention, it comes back, and you are able to take charge, and you will start noticing that you're much more powerful than what you thought, and you are capable of handling it. Why were you running around? Why were you running away? Because you felt you were not having the capacity to handle it. Why do you feel that you don't have the capacity? Because you're operating from the child ego state or that child who got traumatized. You are operating from there. And the child was inferior, feeling inferior, small, incapable, fearful, weak, inferior. And here, when you take charge, you're reconnecting to what we call as the adult ego state. So this is transactional analysis, what I'm talking about. Child ego state, adult ego state. And you have to reconnect to the adult ego state. And that is where you feel the sense of maturity. Maturity is not about I grew and I have educated in this college and this school. You may still be immature. Maturity is nothing else but you are capable of handling a situation in the most appropriate way, in the most rational manner. And I would also add in the least damaging manner. Least. So we all are learning to be matured. But for that, we have to reconnect to the child that is traumatized. We have to reconnect to the child that is traumatized. And that can only happen when we are paying attention to the child. And how does the child express itself? Anyone? Just message me. How does the child express itself? Crying. No. The child in you expresses itself in the form of course, the complaints. The child in you expresses, when I'm saying the child, I'm talking of the subconscious, by the way. That's the child in you. The child in you expresses itself in the form of sensations. The traumatic experiences that creates the inner child. So what is the inner child, first of all? Inner child is that child, that energy that has got, that has stopped, or they stopped flowing, because though we are all energetic beings or energy beings, and the energy has to flow. When the energy flows, we feel healthy. When it's not flowing, we feel diseased, right? So when there's a trauma, that energy freezes, and that frozen experience is what we also call as the inner child. Now remember, it's not an intellectual component. It's an energetic component. It's an emotional experience. There's a belief in it. There's a physical sensation in it. And most of the people, when they're working with the inner child, they're just working with, okay, I'm loved, I'm happy, I am wanted. I can tell you it doesn't work like that. Or it may act very superficially or at the intellectual level, but inside you are more diseased than, more disordered. It's important to heal it where it's begun, and it began in the bodily experience. That is the emotional component, the energetic component. So we got to also heal it at the emotional component, the energetic component, and that is what a somatic therapy does, a hypnotherapy does. So we got to start healing it at that level. Right now, you reconnect to that, and this is expressed in the form of sensation. So sensations, discomforting sensations, are nothing else but the cry of the inner child. And even the comforting sensations or the relaxing is the calm and the easy inner child. It's as simple as that, because we have both in us. Like when you felt that touch of your mother or your father, or that comfort or the love, the happiness, the joy, that's all positive sensations, but that's also inner child. So for most of us, when we talk about the inner child, we are only talking on the negative side. No, but this is also, the positive side is also the inner child. But this all relaxing, calming, positive, peaceful, harmonious, joyful, loving, nurturing, right? And here it's all painful pain. But the attention goes on the painful side, right? So for how many of you this is making sense and you're learning something, right? L, learning. Great. Yeah. Super. Yeah. Good. So now these are sensations. Now, as I said, the only way out is through. So if you want to heal something, you have to reconnect and go through it. Like if you're on one side of the valley, yeah, on the mountain, and on the other side, and there's a bridge. That's the only bridge. Now, the only way back is coming back from the bridge. Or if there's a valley, there's no bridge, you have to come down the valley and walk upwards. So that's the only way. That's what it means. Like you have to reconnect to the bodily experience and then start paying attention to it to heal. And that is what somatic therapy is all about. Why somatic therapy is very, very effective? Because somatic therapy helps you confront or reconnect to the problem at the very deep core level where it started, at the root level. Because it's an experience. It's an experience. You felt it. Now, if you want to heal it, you have to reconnect to the experience. For how many of you this is making sense? Right? MS. Making sense. Now, it's also very important that we start learning. How many of you here want to learn the way to deal with traumatic experience the somatic therapy way? Right? Me. Yes. Yeah. Right. Very good. Remember, it's only in your commitment that you learn something. It's only in your commitment you change something. You have to commit yourself and then take charge of it and then practice. I'm going to give you a small one, but this is can be the most effective one. Let me tell you my story then. Yeah. Some of them know it, but I'll just share this. This was somewhere in 2001. There was this thought in my head that I got to change my profession. That time it wasn't that I want to change my profession. That was just that I want to do something more. And that was just like a intuitive thought in my head, and it just overtook me. And it grew so much that I started letting go of my practice, homeopathic practice. I was doing very well. And over 1.5, 2 years, I was just hoping that nothing works, all my clients should not be there. And I didn't know why I was doing it. It just overtaken me. My thinking, my feelings, it just overtook me. And here, when I'm seeing 10, 12 clients waiting for me before I enter my clinic, and I'm hoping no one comes in and the whole medical practice trickles down, and I don't even know what next to do. And I developed my anxiety and panic attack problem. And that's the time I would wake up at night around 2:30 every night for next 2.5 years, 3 years. And I would wake up with a vacuum feeling in my chest. And it was such a painful vacuum because I cannot reach it also. I still remember, like, if I could reach it, I would pull it out, but I can't reach it. And I wake up and then I sit there for some time and then I start crying, and I am just hurting inside because I don't know what else to do in order to deal with it. I don't even know how to deal with it because it's an empty feeling. It's like you're trying to move a sword in the air, but nothing is happening. You're just moving it. You're not killing anyone. You're not doing anything. You're not getting rid of it. So, like, you don't even know who's the enemy, kind of thing. So, but you're just moving the sword in the air. So that is what I was doing. And it was very scary also, and I would develop that anxiety and all that, and then I would just sit with it and I would feel it. I didn't even know what it meant because there was no other way. And then after some time it would just settle and I would feel so rejuvenated, but at the same time I would just enjoy that sleep after that for another 2, 3 hours. And that is where I still remember writing it down somewhere in my one of the books where I wrote that if I can be with my body for a good enough time, I the all the symptoms will go down, my body will heal. And I didn't even know that what is the meaning of that, but I knew that there's something different about this being with the body experience. And then over a period of time, as I kept practicing, I got into hypnotherapy and all that, and I devised my own healing modality that I call as a core somatic integration. And now I have integrated somatic therapy and hypnotherapy, and I call it the integrative somatic hypnotherapy. And I found this somatic therapy to be one of the fastest mode of healing and therapy. And also an integrative somatic hypnotherapy, I'm able to deal with many more clients because of this combination, and with different ailments. It doesn't matter whether the person come to me with simple psychological problems, or they come up with cancers or intestinal problems or PCODs or migraines. It doesn't matter because I know how to go about with them, because the somatic component is very strong and I know how to go about. Even if you don't tell me the symptoms or the disease, still we can heal it. And that is what I'm training people in, that how do you go to the depths, to the roots of the problem and heal people. And for your knowledge, I'm coming up with this program. Yeah, I'm just coming up with this hybrid program rather, which is like there is online component to it, which and there is live demos and all that, live sessions. Yeah, every week, maybe once or twice for, and this is going to be long-term programs so that people can become therapists, become practitioners, and also learn how to practice it without leaving the comfort of the home. At the same time, there will be offline sessions also where people connect and learn things much more deeper and question answers and everything. So if you're someone who wants to join in, you can always join in. I'm going to come up with it, and soon, maybe this coming month, I'm launching it. I've done some few programs. It has been quite a success, and I'm launching it officially now. Yeah. So if you are someone who wants to learn it, you can always join. And this all certified programs. This all certified programs you can start off. And also one more thing is that I am also teaching how to market this programs, because that is the biggest problem with any therapist and clients and doctors and all that. They don't know how to market it. And I have been in this work, just this work, for 20 years, and as a doctor for 30 years, and I've learned the art of marketing it and having the clients, and how do you speak to them, how do you communicate to them, how do you build up your skills rapidly. So all those things I am training I've trained myself. At the same time, I've trained a lot of people to build up their businesses, otherwise also apart from healing systems. So that is where I learned all those things. Yeah. So if you're someone who is interested, you can send me a message on my mobile number and write ISH. Yeah. And I'll keep you posted. Yeah. And so this is what it is. So now coming back to integrative, the somatic part of it. Yeah. So tell me, till now, from beginning, what have you learned? Just post it on the group, on the what all did you learn? So what we are doing is that we are reinforcing what you learned. Just quick one word. Yeah. What did you learn? Yeah. What is trauma? Okay. Good. Types of trauma. Types we really didn't touch. Yeah. Inner child, very good. Yeah, just keep posting, just keep posting. Whatever you understood. And not just the topic, not just the name, but what did you learn? Trauma is repeated, it is resolved, very good. Inner child talks in the form of sensations, very good. Somatic healing deals with root causes, very good. Yeah. Yeah. So I just wanted what you learned. How to connect with the body is most important. Very true. Very true. Forgiveness is not possible in pain. Forgiveness is possible. Expecting that you forgive and everything goes away, that may not be possible. Forgiveness is possible. You just got to forgive. It's possible. By the way, I've written a book on forgiveness. So that is called Giving Up Something to Receive Everything. Yeah, giving up something to receive everything. Forgiveness is possible. But expecting it that you should be, the other person also should change and everything, and your situation get better. No, don't expect that. Somatic therapy treats both somatic, psychosomatic diseases. Yes. And much more than that. Yes. Very good. And even relationships. It changes relationships. It changes businesses, finances. Somatic therapy is useful in everything. That is what I've seen. Yeah. So this is what it is. So now let's go ahead and learn a bit of uh, the somatic part of it. Trauma is painful experience. The part us staying with this experience is our inner child. Yeah. Now this is another way of looking at it. You may not find in the books. I just thought of it and it just came into my mind and I shared this. So this is what I feel, because inner child is nothing but an inner energetic and emotional experience. So that is what we call as the inner child. At the same time, when we are dealing with trauma also, these are also sensations. That is also an emotional and energetic experience. So it's like it coincides. Okay. So that's another way of looking at it. So let's not get into the intellectual component. Let's get into the somatic component, because till the time you don't connect to the somatic component, you will never heal. Never. Yeah. If at all, it's a traumatic experience. Yeah. You have a problem in your business. Now you need to intellectually work it out and you get a breakthrough in that. That's true. That's possible. But if at all there's a trauma where there's bodily experience, you can never heal it without, because that's the only way out, right? Okay, now let's go ahead and understand. So how many of you are willing to learn a bit of this somatic therapy? Okay, good. And many of the people who have learned it, my students, the most beautiful part I really love is that I've taught them almost, some of them I've taught them 12 years back, 13 years back, but many of them practice it every day. Yeah. So they go through the whole workshop for somatic integration, and they practice it every day, because you cannot, wherever you go, your body goes. Wherever you are, your body is. Only thing, you're not aware of it, and you don't know, you're not trained how to do it. And that is what I do. Okay, so everyone get ready. We're just going to do a small part. Okay, ready? So what you're going to do is that you're going to start paying attention to your breath at your nostrils. You're not breathing in deep, like you're not doing a pranayama or whatever. You're just paying attention to your breath at your nostrils. And just notice how the air goes in and comes out. Just notice where the air touches your nostrils. Inside, right at the root, right on the beginning, or somewhere on the sides of the nostrils. Just observe. And also notice what is the sensation. And now, as you observe, I'm just going to show you one way of doing it. Yeah. Um, there's a lot of it to learn in this, but then, and now just imagine this breath, like wherever you're feeling the breath, maybe in your head, in your chest, in your hand, you can feel a difference in the sensations, some energy or some sensations. Just observe the sensations. So right now I can feel it in my nostrils, I can feel it in my back, I can feel it in my hands, like my hands are like kind of this is running. I can feel it in my calf, I can feel it in my feet, I can feel the pain in my feet now. So like that, it travels anywhere. Now I can feel it in my thighs. And now in my thighs, I'm getting some kind of sharp pain, the left thigh specifically. Now you can do this eyes open, eyes closed. That's the most beautiful part of somatic. You don't have to get your eyes closed. So many of your clients trust you, because many of them are scared of closing their eyes and doing a therapy. So you can do it with eyes open also. So I call it the open eye therapy also. Yeah, and now just breathe in deep and breathe out. Now we are doing a short session, yeah? It's the lack of time. Breathe in deep and breathe out. Stretch yourself, move yourself, open your eyes. Okay. And now I'm going to give some of them an opportunity to talk. Okay. Who would like to share? One person, just raise your hand. Yeah. Daisha, you wants to share? Okay. Anyone who wants to share, just put the digital hand. Okay, Sunil, I got it. Yeah, tell me.
Yes, hi everyone. So, when we first started, I could feel the breath going through my nostrils from the tip, and immediately I started feeling a tingling sensation at my temples running back to my crown area.
Hmm.
It kept intensifying the more I focused on my breath, and after a while, it traveled down to the back of my right eye, and it was a very sharp pain
Hmm.
after which there were these jerks in different parts of my body.
Hmm.
It started with my left hand, then my right leg, then my tummy. Uh, just a lot of, I think, stuck energy
Hmm.
jerking and finding its way out.
Hmm.
Yeah, that's what I
Good. And
experienced.
how do you feel after that?
Uh, I think I'm still not
Processing.
done releasing it
Yeah.
entirely. Yeah, I'm still in the middle of it. I can feel my
Yeah.
body a bit worked up. I'm more
Right.
aware of all the sensations
Yes.
present.
Yeah. Just in case you have more of it, all you can also you can do one thing is that you can just run your hand and that will close. Just in
Okay.
case you are in a hurry or whatever, you can just run your hand and you'll suddenly feel a sense of relaxation coming in.
Yeah, I felt a wave of calm immediately
Yes,
when I
yes.
touched it.
So
Yeah.
that's a good way of doing it rather than just leaving it open. Right? It's like you don't leave the wound open. Just run your hand, focus on your breath, and you just will calm down. Maybe you can lie down, drink some water, go to your work, come back, and you can do it again. Yeah. Cha. Thank
Got
you.
it.
Yeah. Okay. Yeah, Shiv.
Yeah, thank you. So for me, while I was going through the experience, I felt some increase in my body temperature.
Okay.
And since I was closing my eyes, I could see some spectrum of colors, and that was dominated more by red color.
Okay.
And I was feeling some kind of sensation in my chest area,
Hmm.
as if something is stuck and wants to be released.
Okay. Yeah, go ahead.
And yeah, so those are the three observations I've had.
Great. Awesome. Yeah. So just connect to that. So you connect it to this sensation of feeling stuck and then the colors and everything. So just be that. That is how your subconscious has presented itself when you connect to the body. Yeah? Good. Yeah. Anyone else wants to share? One more person? Very quickly. Okay. Right. So let's go ahead. I'll take you one more step ahead. Yeah. How many of you want to go one more step ahead? Right. So let's go ahead. One more step. Okay, great. Yes, I. Right, good. So let's go ahead. So what we are going to do is that now you're going to connect to one small traumatic incident, not the big one. Don't take the big one. Yeah, मेरे life की वाट लग गई है. Let me take that and resolve it today. Don't do that. Like what Daisha also mentioned, that I'm in the midst of it. I just started. I'm in the midst of it. So that is exactly what happens. So don't think that, oh, you get in there and I crack it today only. That's going to land you in trouble. मतलब आप पिटारा खोल रहे हो, याद रखना. Okay, and many people who have got the shifts, like there's a point in everyone's life where suddenly life starts changing. How many of you got that? And let me tell you, that's like, and after that, they can't stop it. It's I call it the rolling down the mountain, and there are no rocks or the plants or trees that will stop your uh, uh, going down. Are you getting me? The rolling down. It's a very smooth mountain. So this is how once it starts opening up, it keeps opening up. So you have to be careful. And that's why take your time. You have half an hour, 45 minutes. Aram se baith ke karo. And the best thing is to take help and support from someone. Don't try to do everything and healing and everything on your own. Never do that. Always, when you're healing deeper issues, financial issues, business issues, relationship issues, take help, take support. Okay, there's a specialist who have trained themselves for years and they can help you because they can see what's happening. You on your own, you might just be ruminating and you think I'm in the body. No, you might just intellectually be ruminating. Right? So be careful. Okay, so let's do it. Close your eyes this time. And this time, what I would ask you to do is just take up one incident, small. It could be a recent incident, like a tiff with someone, or you're upset about something, right? And just take that small one. Don't take a big one. Okay, or it could be just that I have this irritating thought in my head, or this thought that I'm upset about something, small one. And I'm just going to take you through the steps. How many of you are interested in that? Raise your show me a digital hand. Yes. Yes. Very good. Ah, that's good. So let's go ahead. You may close your eyes or you may keep it open. That's perfectly okay. Yes, Rajkumar, Swatika. Yes. Thank you, thank you, thank you. Yes, Vinod. Great. Just close your eyes for a moment. And I want you to just pay attention to your breath at your nostrils. And when you pay attention to the breath at your nostrils, I want you to connect to that upset or that discomfort. And notice, where do you feel that discomfort in your body? And remember, don't analyze it. Don't say, oh, this could not be. Maybe there's something deeper, because a discomforting sensation cannot be so superficial or low in intensity. Doesn't matter. Whatever it shows up the body, just observe and notice where it is happening. And remember, there are favorite spots. They keep showing up in the same place because that is how they try to grab your attention. And when you have that, I want you to pay attention to your breath. You have the discomforting sensation, but you pay attention to the breath and notice how the breath is. It could be short, it could be sharp, it could be fast, or it could be like breaking. It could be anything, like a staggering kind of thing. All you got to do is just pay attention, but your attention is on the sensation also. But as you pay attention to the sensation, however discomforting it is, you are paying attention to your breath. You're not trying to change your sensations, nor you're trying to change your breath. As you pay attention to your breath and the sensation, there is a possibility you might start seeing some shifts happening in your sensations and your breath too. If you feel there's too much of thoughts or you feel there's too much of discomfort, bring your attention more on your breath. There's a possibility you might feel some kind of tingling in some parts of the body. That's a very good sign. That's called a discharge. Or sometimes there's a sudden twitching of some muscle and then it reduces. That's called a discharge. And as you do that, for some of you, you might have a burp or just a tear coming out of your eye or some runny nose or salivation or tingling in the hands and feet or any part of the body. Or your breath might just get a little more deeper. But as this happens, there could be a possibility that there are parts in your body or that area where you had this discomforting sensation suddenly getting released. And there's a sense of relief. Or there could be thoughts that this is what you could do or you should be doing. That would help you. As if the mind, you're getting the answers from the mind. And suddenly there's a sense of relief. Like when I'm doing this, I can feel my breath relaxing as if my breath is going into my legs. My belly, I can feel my breath going into my belly. So that's feeling very good, as if there's more space in my body. Now, you may or may not feel this, you might feel something differently, but that's your experience. Yeah. For me now, my breathing is getting much more deeper. I'm getting a little more calmer. So breathe in deep and breathe out. We are slowly going to come out of this relaxation or meditative experience. So breathe in deep and breathe out. Become aware of your breath. Move your hands and feet. Move your hands and feet. Stretch yourself. You may run your hands on your face, your head, and your entire body. And then open your eyes. Okay. Good, everyone's back. So now, anyone who wants to share the experience, especially the people who haven't shared, if you're interested in sharing, please let me know. Just lift your hand up. Show the digital hand. I'll call you. Yeah, yes. Vinod. Yeah.
Hi, sir. While I was thinking about small incident, immediately I get the palpitations.
Right.
तुरंत आ जाता है and it gets response very quickly. Very
Hmm.
active रहता है palpitation.
Hmm.
So that's what I could see fluctuations in that
Hmm.
coming down high, and my thoughts were going somewhere else also for some time. And that's it. I mean, when I focus on breathing, I forget about the palpitation. When I focus on palpitation, I'm not able to observe breathe so consciously. So that is what my state is. I mean, बाकी इतना deep नहीं जा पाता हूँ till the legs. Breathe only till the
No,
chest
no,
area
that is
or
my experience.
yeah.
That was because I was coming to an end. So I wanted to also help you all so that you also observe so that we can stop it and then we can come out. Yeah. That is
Yeah.
what I was sharing. Okay. Now, that's a very good thing. Acknowledge yourself for going through it. And also, that's a very good thing. For many of us, when we get palpitations and we get this discomforting sensations, we get discomfort and we say, oh, this shouldn't happen. But that's your body's way of talking to you. It is communicating that this is what is happening. Because if you are an anxiety person or whatever, palpitations is normal, right?
Hmm.
So when
True.
it comes up, the only way out is through the very door that you entered. So this is what happened. Anxiety, I feel anxious and I get palpitation. So when you pay attention, first thing is going to come up is the palpitation. Because
Hmm.
that's the only way to come out of the anxiety. There's no other way.
Hmm.
Are you getting it? So that's a great
Yes, yes,
thing.
yes.
Okay. So good, you went through it and you pay attention. Now, what happens is that people don't want to experience this, they try to push. No, I should not get the palpitation. So there are so many people who don't want to have it. That's why they keep taking medicines. But they, even
Hmm.
after 20 years, they are on medications only.
True.
And the body is numbing. And that gets more, they get more of a disease rather than getting freedom.
Hmm.
And they have never been able to experience. That is what we are here for. We are not here earn money and everything. We are here to experience life. How do you experience life? Through your body sensations. As simple as that.
Sir, I have one experience. I just wanted to know what it is. Maybe you can guide me in that small incident.
Yeah.
Uh, while I was discussing with someone, he touched me to some point where I got hurt and I was listening to him, the inner self somewhere in under. So it went so deeper and I could feel the pain like a scar, like the outer scar. I could sense that for a few seconds and that disappeared, but it is same as the scar pain which we have in the outer wounds. So what could be that
So
thing?
basically, see, what we see as a scar outside, as I said, it's a bodily experience, a bodily sensation that you felt as if that's a scar. Are you getting me? But it's just a bodily experience. Now you got to, now it is not that, and if you're connected to the scar, you're also connected to a memory associated, if you notice. You know when you had it. It could be 5 years back, 10 years back, 3 years back, or that person said this to me. So this person actually, when that person spoke to you, it connected to that memory. That is how it is.
Okay.
Now that's an opportunity for you to heal also if you pay attention to it. The door you get through, get into the room, that's the only way out. So it was touching that scar. Now it's a great opportunity to heal.
I was telling myself, or pain. I just wanted to see that pain.
Yeah.
But
Okay. Good. Great. Anyone else wants to share?
Yeah, I wanted to ask something.
Yes. Who's that? Ajay.
Yes, sure. So
Yeah.
I wanted to ask with respect to this anti matlab antidepressant drugs and all. So antidepressant medicines, matlab drugs means medicines. So like for example, last week also I had viral fever for 2 3 days, and I had gone to my family doctor, and he knows my entire background and what all therapy and all everything I have been taking, and he has been recommending me to take these antidepressants. So he had in fact even started also for a week. SNRI is what the category is: serotonin and norepinephrine reuptake inhibitor. I think name of the medicine is Dunzo, 10 milligram or something. So I just wanted to understand ki, matlab, is it really worthwhile taking that, because he's saying that the repeated the repeated illnesses that I have, especially with respect to stomach upset, indigestion, and all, is largely caused by the excessive stress, anxiety, depression that I'm carrying. So he suggested me again this week. I obviously have not started yet. So is it really worthwhile, matlab, for cases like me which are taking a lot of time? So is it worthwhile taking this, or should I just continue the therapy and wait for improvement?
Okay. So firstly, let's consider this, that if I'm just talking to you for the first time, if I don't know you, yeah, then I would say that you will have to, okay, let me put it like this. All the diseases that you get, including all the physicals, are coming from some kind of, there's an emotional root cause to it. When the emotions are disbalanced, then it starts expressing in the form of physical diseases. That is why we call it psychosomatic. So what the person doctor is saying is very right, that the stress is causing it, but just taking the medicine, sometimes what happens, the stress levels go down and then you can work with the therapy. But it's also important or good if you can manage to just do the healing work, the therapy work, and deal with the stress, the physical symptoms will go away. Right?
Sure, sure, thanks.
That is how it is. Yeah. And rest, whether the medicine should be taken or no, then the psychiatrist himself has to tell you that.
No, he's a normal physician. He's not a
Regular
psychiatrist.
physician. Okay. Not a psychiatrist. Yeah. Chale. Yeah. Your question is answered.
Yeah.
Yeah. Thank you. Right. And yeah. So open your video so that I can see you. I don't know how can I. Okay. How does this work? Why is it? Yeah, go ahead. Go ahead.
Can I?
Yes, you can.
Okay. So when I was going through that meditation a while ago, there was some strange sensation in my stomach this time. And I have a past history of ulcerative colitis, uh, which troubled me for about 10 years, and now for the last 30 years it is in remission. I wanted to know whether, like they say, ulcerative colitis is never cured. Is never cured.
Who's they?
I mean, the gastroenterologist told me that.
Exactly. Exactly. And I can say that it's curable.
Okay.
Hmm?
I felt always that, stress played a very important role in that
That's
episode.
the truth. That's the truth. Stress is nothing else. What we call as stress is nothing else. There's normal stress and there's stress which creates problems which we can't, which is going beyond a particular threshold of what we can handle. That is what is causing the disease. And once it happens, again, as I said about the traumatic experience, it stays in the body till the time you don't heal it. So then it can produce, and if there have been deep-rooted stress or complex PTSD and all that, then it can show up as diseases because it's not been taken care of, and we are not trained in that. So you have to give good time, enough time for the healing to happen. And I think you should be meeting a proper therapist if you want to get into a therapy.
And can this kind of trauma, like long-term trauma, can it also cause some neurological issues? Like I had a stroke.
Anything,
I had a stroke in 2022.
anything,
It
any,
can.
anything it can cause.
Okay.
Okay, because then the trauma, depending upon the trauma, it has a particular affinity towards particular parts of the body, depending on the emotions and everything. Okay, right. Okay. Okay. So, any more questions? We can stop over here.
I wanted to know more about that program which you mentioned.
Okay, I'm going to talk about it. Yeah. So basically, this program, what I'm going to talk about is like there are different programs that I do. One is called the core somatic integration, which is completely a somatic therapy based thing where you learn about trauma, you learn about how trauma is caused and how do you heal it, just connecting to the body. And many of them have healed of severe pains and their problems and of anxiety, sometimes within the workshop. Otherwise, over a period of time, they have seen the change, yeah, which I talk about and I show how to do it step by step. That is called core somatic integration. The one program that I'm coming up with, it's an old program. And the second program that I'm coming up, which is a new program, which is going to be where you can get certified as therapist. Yeah, where you can get certified as therapists and you can start your own practice or you can use it for your self-healing is the program which is called Integrative Somatic Hypnotherapy, where I've integrated more than 9 healing modalities, right? Because I've seen in my practice that having an integrative approach with somatic therapy being the base, it has given me uh, it's like I have a lot of tools to deal with any kind of situation, be it psychological or pathological or just a relationship or business or health or uh, any kind of issue. I found it to be useful. And at the same time, many times people who want are not very clear about what they want and how they want. They just have to reconnect with the body and they have found a pathway for themselves. So it doesn't matter whether they come for career and all that. So I work with addictions, I work with traumas, I work with migraines, I work with gastroenterology problems, and a lot of things, Crohn's disease and PCODs and many diseases over a period of time and tumors and all that. So this is what it helps. So integrative somatic therapy. So this is currently I'm coming up with this program where initially and it's a initial is an online thing where you learn what all I'm going to teach and all that. That's one part where a lot of videos are offered so that you can see and learn about it. Yeah. And along with that, there are a lot of live sessions where I'm doing the demos. Like right now, what we are learning, I'm doing the demos, and you can learn how to do it, and in different situations, what kind of modalities that can be used. And then you get to practice that, maybe within the session with your partners or otherwise. And how do you go about doing all that? So that is what we are learning in the initial level. And then there are higher levels, and all of them are certified. And then at a later point, you get certified as a master practitioner. And so a lot of deep work is going on. And at the same time, I'm also coming up with this offline also. But that's not separate. It's a hybrid model. You can't just choose offline and not this. This is for making it much more easier so that people can learn everything. And we are not spending too much time, because all this, what I've learned, I've taken more than 15 years to learn. Because each course is like at least for 1.5, 2 years, 3 years. So what I've done is that I've compressed it, I put it all together, and then I'm teaching the practical side of it. At the same time, the theory and all that you can learn through the videos. So that is how I'm doing it. And then you can practice. Then we are going to have groups and all that where we practice each other with each other. And then whatever questions are there, that can be handled. So I'm very sure that this is going to be fast pacing the whole learning. This is what I'm doing. Hope this is clear. Yeah, more than 9 modalities, not just 9. I'm very sure I just thought of 9, but when I'm putting it down on paper, it turns out to be much more than 9. Because there's so many of them that is there, but then I'm not going to say that, oh, this is what we are doing. Like I'm not putting it on paper, but there can be more than that. And then, of course, we are going to learn how to deal with relationships, specifically what happens in a relationship, what actually causes the problems in relationships, and family therapy. Why do families, and families also means any kind of group dynamics, how do they break down? How do you deal with the client? Like I have so many cases where there are issues in the family and the whole family is coming to me. Most of the people say, oh, you should not be taking another person from the family. I have a lot of families coming, and all of them come separately, and sometimes they come together, and they keep getting breakthroughs. There's a particular way to do it. So this is what is going to be taught. Okay. So if you are interested, you can always connect. You can always send me a message. I'll just write mine. Okay. Any